We're going to talk about the underlying issues that make us have such a bad curve and a shorter life expectancy than we should. Has a lot to do with the cardiovascular disease epidemic happening in younger people. Now, this is really something that we thought we had gotten over because we have the bypass surgery and the stenting. But people having events and having a bad outcome is something that we're starting to see way more than we have in the past. And it has to do with these underlying features, the obesity, diabetes, hypertension, and high cholesterol. So we're trying, towards organized medicine, by doing everything I can to work with organizations to try to get the message out. And so our American College of Cardiology, American Heart Association, we put out management guidelines, we put out prevention guidelines. And these came out really 2 years ago. And yes, there was a message about cutting back on the use of aspirin if people were lower risk, because it can cause some bleeding without the real benefit. As opposed to people who really have established high-risk disease, those people definitely should be on aspirin. But it's talking about improving or removing all of the risk factors, doing more exercise, and the cornerstone down in the left-hand corner is nutrition, doing as much as you can with a plant-based diet. And so I'll come back and talk specifically about those guidelines, but I'm hoping that everyone will recognize that we have some large organizations that are on the side of prevention, even though it might cut our revenue a little bit, it would improve our lifestyle, and the burnout would be tremendous. So we would gladly make that trade to improve our outcomes instead of our income. Back to COVID for a moment. When we talk about the obesity and these risk factors, we have to throw one in, and that is the smoking. We don't always talk about that in a nutrition talk, but it surfaced to the top just a few weeks ago when this was published, saying that obesity, your body mass index being elevated, and smoking increase the severity of COVID illness, whereas physical activity and maintaining a healthy lifestyle, including diet, would actually be protective. I'm going to dive into that a little bit more and weave it in throughout the talk. So our obesity epidemic has been blamed for so much of the COVID deaths. What is it about COVID and obesity? Well, you can see the numbers, 3.68 right in the middle. Even if your body mass index is just overweight, that is a body mass index of greater than 25, you see that in that increased odds ratio, that is a 368% increase in the likelihood of having a bad outcome with COVID. And this is why. Now, if you're not an immunologist or a physician, you might not be interested in this, but there's some underlying features that you should know. The coronavirus is basically some viral nuclear material to make sure it reproduces itself well. We know that it fails and mutants happen. That's how it occurred in the first place. And that's why you have the variants in the UK and South Africa and Michigan, and we're hoping that the vaccines will cover the variants. But the whole idea of the virus is to reproduce itself and then attach itself to the organs that it wants to be in. Well, one of the organs it wants to be in is actually adipose cells. Adipose cells is a nice scientific way of saying fat cells. And so the more fat cells you have, the more opportunity you have for COVID-19 or the SARS-CoV-2 virus to reproduce itself. It's got all of the elements that it needs because it is made up of this nuclear material, and it's made up of a so-called lipid bilayer. It's made up of fat, and then the spike protein. And so when given that, you would think that people who are overweight are going to be overwhelmed with more viral growth. That's true. But on top of that, obesity does render the immune system less effective. And for all the reasons that you've been reading on this slide, you end up with a weaker response to the higher level of infection. And you get this so-called cytokine storm because the fat cells actually release so-called adipokines, the cytokines that make people really, really sick. So obesity is the one thing that folks can actually change a lot of weight in a relatively short period of time and protect themselves going forward. We know what causes it. It's the diet, it's the lifestyle. We're not exercising nearly enough, too much in the way of refined grains, red meat, big meals, unhealthy fats, sugary drinks. And it is very difficult to work with guideline organizations and find out that you can make federal guidelines telling people what they should do, like 2 to 3 cups of vegetables every day, and 90% of Americans not doing it. And so we are setting ourselves up to have the kinds of outcomes that we're having. I want to put a graphic point on this, because part of my talk is dedicated to ethnic disparities here. And so these are the states in the United States that actually have more than 35%, seen in dark red, 35% of the population actually having obesity rates greater than 35%, more than 1 out of every 3 people. But if you segregate it by ethnicity, the non-Hispanic white adults, it's like 6 states, okay? If you look at the Hispanics, it actually is substantially more, it's just about double, a little bit more than double. But if you look at the African Americans in the United States, there's just a handful of states that do not have African Americans, more than 35% of us having obesity. And so this is an issue that is driving all of the illness that we've been talking about throughout this talk. Now, this was a cute slide from CDC until you realize the figures that more of our African American population is eating fast food on a daily basis, and these large serving sizes are very, very deleterious.